Okay, so Ronan, we're going to do a little bit of demonstration here for the people, and it's always nice when we've got somebody with an actual issue and not a fake issue, so we're just pretending it. So, can you tell me what's going on?
Yeah, so I find just vocally getting quite tired in this area here, quite a lot of pain coming when singing, often when I was doing a bit of teaching work recently as well. I found by the end of the day it was just a lot of effort to talk. So just really sort of feeling it down that side, sort of ongoing issue that I've had for quite some time now.
Okay, about how long have you had it?
Around 4 years.
4 years. Is it getting worse, getting better?
I think there are moments where I think it's getting better, and I think sometimes where I sort of not find difficulty as such. It maybe take till the end of the day before I'm like, okay, that's it, closing down, I'm tired.
Okay.
Other times I kind of, within a few hours, I'll be like, okay, if I'm in a rehearsal or doing a long day of singing, I can get tired quite quickly. So it does chop and change, but I would say it's been ongoing rather than it's not. I've not noticed it ever disappear. It's always there, whether it's just the intensity of it that changes.
So you use the word tired, right?
Yeah.
What does tired feel like?
Tired, I think, is when it becomes an effort to sing. I mean, obviously, anytime I'm singing or performing, there's always effort required. But I think the idea that you're having to go beyond what I've been trained to do to actually really sort of push myself into that. So it becomes, I guess, tight, sore, almost like a lump down the side of my neck, and just. I guess it is painful. It's not a pain where you're ow.
Yeah,
it's just but something that you become so aware of, and I guess then mentally it becomes much more of a problem as well. That sort of takes over, which then affects other things, the way that the body operates as well.
And it's worst, how bad is it? If you had to give those 0 to 10 number scales, to a 10 being the worst imaginable, how bad does it get?
I think the worst I've had it where I guess I've just shut down. I guess I've kind of just had to stop what I'm doing because I vocally become so tired that my voice weakens. There's no way I'm getting up to my top notes that I can usually get to. I sometimes find it easier going to lower register where I'm not used to going to lower register. But at its worst, I'd say it's sore. It's a loss of voice almost. It becomes, I'd say, my maximum volume is half of what it usually is on a normal level.
So rest helps?
Rest helps, absolutely. Yeah. I think the only thing I find that really helps is just to stop doing what I'm doing. Obviously, when it's your job, that's not what you want to do. Yeah.
So to stop doing it, is it by the next morning you're fine again?
I'd say my voice feels fine in the morning, but if I then start singing or having to teach or talk above people, straight away it'll kick in if I've not actually rested it for a few days.
Okay, you've been scoped?
Yep.
And what did they find?
They didn't find anything that was in any way they thought would be affecting my voice or throat in any way. So.
Okay, so if I asked you to sing right now, is there a place you could take your voice where that? Well, first of all, before I do that, can you feel it right now at rest, or is there nothing there?
No, I'd say at rest, usually I can't. If I have sort of had that activated, I can often then feel it afterwards. Yep. It'll sit with me all day. I'll start sort of poking into my neck as well, which I think that makes me even more aware of it. But if it's sort of that's been activated, I can. So
by singing though right now, could you do it just in this brief time right now, or is it like later on at the end of singing for a long time? Can you make it happen right now?
I think something, if I'm going into my upper register, something newer that it could.
Do you want to try it?
Yeah, of course. I'll just go for a moment. Always believe in your soul. You got the power to know you're indestructible. Always believe in you are gold. Something there.
Did you feel it?
Yeah, I could feel it sort of just starting up in just under that area there.
Okay. It's starting. What is the felt sense? You gave it an it. Can you bring it up here to like consciousness? Describe it.
I guess it's almost like a pulse that starts there. I guess is the way I'd describe it. It feels like a lump sometimes that then gets bigger as my voice maybe fatigues more.
So Ronan, what I want to try and do here is we're obviously doing some demonstrations for the camera here. Excuse me, but I want to just do more than just a demonstration. I want to see if we can actually, number one, can my touch connect you with that symptom? Can I do something where you're basically saying the equivalent of, well, whatever you just did, that replicates or that connects in with that feeling, or maybe even the opposite. Maybe it makes it actually feel better, right?
No.
But I want to do something with my hands that you can say, yeah, right there, that's it, or that's part of it. And then we'll just go right from evaluation to treatment, which is exactly how I do this work. One rounds right into the next with sort of a feedback loop. Can we do something from an intervention so that if you try that same piece or that piece of a piece afterward, does it feel different, okay? And I know we're taking a risk because I don't know if I can help you, but I don't know if I can help anybody until we give it a try. You're willing to try that?
Yeah, of course.
Okay, great.
Cool.
Okay, so Ronan, what I'm going to be doing is, if it's okay with you, I'm going to be standing behind you. Now, if we were in actual treatment, I would have a mirror right here, okay, a full-length mirror, so I can see your face, because I can't see your face from behind, but I prefer to treat from behind. The mirror's there so I can see your face, but it's also there so you can see me, right? Sense of safety, you know what I'm doing back there. But we're going to be sort of treating a little bit without that, having that nonverbal abilities. So I'm going to depend on you to maybe over-verbalize what you're feeling just because I can't see your nonverbal. So if I hit something, if I start to get close to something, let me know, okay?
No problem.
And I use a pillow behind you, not to make you comfortable in terms of leaning back on it, but so that you can lean into me and feel like you can do that safely without this feeling a little creepy, like you're leaning into my chest, okay? It's also kind of a personal professional boundary between the two of us. Okay, what I want to do here is I'm going to get my hands in the general region of this part of your neck, okay? And what I'm going to do is, I explained a little bit to Ronan off camera, my goal is I want to do something with my hands. I want to move into that space that he was talking about, the area of tension and tightness and where he gets that vocal strain. And I want to put some pressure, some stretch, explore back and forth. I want to do something with my hands that begins to turn on that sense of relevance to Ronan, okay? Whether to connect somewhere on the continuum from, you took me to the edge of awareness of that fatigue or that strain, or maybe even you made the strain feel a little bit better, but I want to be somewhere along that continuum of relevance, all right? So whenever I work with somebody, after explaining what I want to do, why I want to do it, and getting permission to do it, the first thing I do, and they give me permission, when I put my hands on the patient, is to do nothing, okay? Before I start doing anything, I want to do nothing. And if I had the mirror in front of me, I'd be able to better see if I had triggered something or potentially triggered something in Ronan. I'm working a little blindly and I can't see that, Ronan. Does this feel okay?
Yeah, of course.
Yeah. So at rest right now, do you feel any of your symptoms?
I feel a slight tightness, but nothing, not
Okay.
as extreme as it would be.
Sure. In all the questions we had before, the question was asked, well, where do you start? Well, Ronan, where should I start? Where do you feel it? When you feel it?
Sort of in the neck.
In through here?
Yeah.
Yeah. So I'm going to start where he feels the issue manifests. Get into cause and effect and all those things. I'm going to validate what my patient is telling me by beginning right in that area. I'm working on both sides of his neck. Some of it's compare and contrast so I can feel what one side feels like versus the other. I'm not pathologizing what I'm feeling. I'm gathering data right now. And to myself, I'm going to verbalize what I'm feeling and thinking to myself. I'm thinking, well, this feels a little thick, a little tight, a little chunky right up on the upper right side, almost posterior suprahyoid region, right in through here. I'm not telling my patient any of this. I'm just wandering around looking for interesting areas. But most importantly, I'm watching in the mirror for reaction from his face. I can't see that. Ronan, what do you feel?
Yeah, it's getting tighter on my right side more, so I can feel a sort of a stronger connection maybe on the right side than I do on the left side.
Okay,
so
stronger connection with...
Sort of I feel more pressure, I
More
guess.
pressure.
Even though I think you're applying the same amount of pressure on both sides, I
Yeah.
just feel it more on the right side.
Yeah, I feel like I'm using pretty much equal pressure, but it feels different on one side than the other, correct?
Yeah.
Yeah. Am I replicating some of that fatigue feeling you talked about? That pain or strain?
Yeah, a little bit. It's just that sort of tightness that goes.
When I did that?
Yeah, a little bit. Yeah.
Yeah, okay. With your hand, you can put your hand right over my hand and show me where you'd like me to put more or less pressure. Do you want to do that?
Yeah.
You take your hand and just show me where you feel like I need to treat.
I feel like up
here?
Area, yeah.
Yeah. So as much as possible, I make my work completely patient-centered versus me doing all the diagnostics and all the treatment decisions. Some of it comes from me, but it really should be a partnership, a negotiated partnership where the two of us, we come together for evaluation, like right there, and then Ronan decides, am I hitting something that's relevant right now?
Yeah, a little bit.
A little bit?
Yeah, in that area.
What you want me to try and find a little bit more?
Yes.
Yeah, so let's just keep wandering around here. And what about now?
I'd say it's tight, but
More over there?
yeah.
Yeah.
So.
So right in through here.
Mhm.
Yeah, okay, so am I replicating that feeling a bit now?
Yeah,
Yeah.
definitely.
Okay, 0 to 10, how aggressive am I being?
2.
2, okay, what number would you stop me at, do you think? What number would be the number you'd say, oh, well, that's just too much?
7.
7. So does this feel safe? Okay.
Definitely.
Now, the next question I ask you is a tough one for some people, and you'd think that a patient or a client may not have any way to answer this question, but you'd be surprised some do. What I'm doing right now, Ronan, does it feel like does this stretch feel like it might be helpful?
Yeah.
Yeah, and he might have said, no, I have no clue, and I would simply keep searching for a pressure or direction or something so he can say, oh yeah, right there, that's it, hold that. So the neat thing about working from a model like this is evaluation completely flows into treatment. If I quote unquote find something and Ronan validates that whatever you just did there, that feels familiar and it feels like it might be helpful, then treatment is initiated completely from that point right there. Whatever I did to Ronan to make him feel like I replicated his symptoms becomes how I start the treatment. So what am I doing? I'm stretching, right? I'm pressing. We're doing a little bit of maybe right to left manipulation of the posterior laryngeal area, the posterior hyoid area. What am I stretching? Well, skin, fascia, muscle, cartilage, bone, nervous system, a lot of stuff. The thing that I care most about, am I stretching the feeling that gives you that fatigue? Am I?
Yeah, definitely.
Yeah. So in this sort of treatment model, if you were to watch this as an observer, it looks like nothing's happening. It's almost like watching paint dry. But to the two of us, it should be really interesting because we should be both engaged, especially my patient. My patient should know what I'm doing at all times or I'm not doing my job properly. Meaning relevance is established and is maintained throughout the entire therapeutic engagement or I'm not doing my job properly. So how long would I hold this? I hold it for a while. What's a while? A while could be 3 or 4 minutes. A while could be 10 or 15 minutes. I hold it until my hands get tired. I hold it until the session time's up. I hold it until Ronan says, okay, I need a break, right? The goal of it is when we stop and Ronan goes and tries that range again, that he feels a difference. And what drives that change? What keeps the changes going? Well, it could be, if you like the tissue model, that we stretch the tightness. It also could be we altered his perception, his sensation, that he now sees, hopefully, that change is possible, that he's not always going to hurt like that. And it's certainly our job to continue some of those gains. But I think a lot of this is predicated on simply his changing his awareness of what's potential. So I'm just going to let go for a moment there. And where I was most of my pressure was on this part of my hand. This is a sequence that I teach in the workshop among a bunch of other ones. And in essence, I was pressing in and then dragging downward and forward. I could have pulled in and up like that, or we could have gone down straight like that. I could have taken some of the more traditional laryngeal manipulation handholds and slowed him up a little bit. I understand manipulating the larynx has great value therapeutically. But is that really that much different than me doing that with a static hold versus a dynamic manipulation? I don't think so, all right? I actually think there's some benefit to this static hold because it gives Ronan a chance to process. Instead of me moving back and forth, where he may not quite ever get that feeling of relevance or familiarity, I believe there's value in hanging out at end range, if you will, allowing Ronan to establish that sense that, yeah, whatever you just did, that's it right there, that's part of it. And it should feel good, it should feel safe, and it should feel relevant. Is that part of it right there, Ronan?
Yeah, definitely.
Yeah.
I was going to say that I feel that much more than when you were actually going back and forth.
Yeah. So with the tip of my third and fourth fingers, I found a little crud pocket. And it's a medical term, crud pocket, okay? They're going to want to know, well, what is it, right? What is it? Is it a knot? Is it a fascial restriction? It's like, you know what, Ronan, you've been told a lot of different things, possibly, that people think are wrong with you. I'd rather not add one more thing to that list of pathologies. I'd rather just say, I don't know, it feels like a crud pocket. Let's see if we can make it less tight, okay? We obviously have to know what's there from a medical and safety perspective. I can't document crud pocket on my insurance forms, but to him, I really don't want him to get the thought that, oh gosh, there's one more thing wrong with me. Can we simply hang out at that area of tightness that he identified as, yeah, that's part of that feeling, and can we introduce the possibility of change? And that's really what the crux of the work that I teach is. All right. If we were actually doing treatment, we'd spend a long time. We'd spend maybe longer than that, although I don't know that we necessarily have to spend a long time. I might spend time working with you in the chair, working with you on the treatment table, maybe standing, all sorts of different positions, right? But do you feel like you want to go ahead and try that piece of the piece again?
Yeah, can do. Gold! Always believe in your soul. You got the power to know you're indestructible. Always believing you are gold. I'm glad that I'm bound to return something I could have learned. You're indestructible. Always believing. Yeah. Oh, yeah.
Okay, so total subjective feedback right now, and what I don't want this to be is you telling me what a good job we did.
Yeah.
But I want to know, how did that feel to you?
I didn't feel at all like constricted, so I didn't feel, sometimes when I sang it before, it almost felt like everything was going like whoop in that area, so it was all like squashing up, so I guess constriction.
Yeah.
And then I think that came out in the sound that I made. Whereas doing that there, it was easier, and I didn't actually want, I think a lot of the time when I'm singing now, my brain goes to this area. Yeah. So even if I don't feel the pain, my brain still goes, and sometimes I'm aware that my shoulder, everything comes up when I do that.
Yeah.
So actually when I was doing that there, I was just like, oh, cool. And actually I kind of was like, oh, I like the sound of my voice right now.
Good.
Whereas when I sang before, I was like, oh, like, that's not how I want to sound.
Okay.
Or it's not how I know I can sound, I guess. So yeah.
In my totally my totally untrained ear, I'm not going to pick up the nuances that a professional would, but I'm also not going to pick up the feeling, that felt sense that you're going to feel, right? Because that's really what I go for from my perspective is, what does that feel and sound like to you? Because we're looking for change that you can perceive, so that, maybe we stretch that tightness, or maybe we're giving your brain the perspective that change is possible, and let's just keep working on it.
Yeah.
Right? Yeah. All right. Cool. Do you have questions for me on what we just did?
No, I guess I think you were kind of, because you were explaining as you were going, it was interesting I like the way you said to not give another reason of what it could be. So, because I have been told by many people, oh, it's this, it could be that, and actually, anytime I've spoken to to yourself, and I've spoken to Stephen before as well. There's never been a, oh well, it's this, that.
Yeah.
It's more actually, okay, this is tight. How do we go about fixing it? And that there's not necessarily, it's not just as simple as you have this, we'll do this.
Right.
It's about exploring and kind of actually working together to create a sort of,
Yeah.
I guess, a way of untightening it.
A partnership.
Releasing it.
Yeah.
Partnership,
Great.
connection. Yeah.
Yeah. All right. Thank you.
Cool.